All right. Well, we've got some real special people with us here today. I'm going to allow each of them to introduce themselves. This is the team from Metrex. We are anticipating one more person will join us. The most popular man on the internet, Chris Pellegrino, will be here shortly. But we wanted to get started. Jessica, it's always ladies first. Please tell us how you're doing, where you are, and a little bit about what you do for Metrex.
Okay, thanks, Ian. I am Jessica Williams. I am a marketing manager with Metrex. I like to say I'm newish. I've been with the company for about 5 months. It's been great so far. One of my primary responsibilities in this role is to really support our distribution partners such as NDC. So having a great time kind of getting to know you all and providing all the collateral that I can and just keeping you up to date with our campaigns and different initiatives that we have from a marketing perspective.
Yep.
Personal note, I am in Southern California, so it's nice and sunny here. Beaches are kind of packed, although people are observing some social distancing rules, so that's good. COVID has not affected my family, very grateful for that, but definitely feel for those who have, and we are all doing well otherwise. So
awesome. Well, and probably the highlight of your 5 months is joining me on LinkedIn yesterday as I accepted.
I did do that. Yes, I did do that. And it was a highlight.
All right, Jason, over to you.
Hey guys, glad to be here. So I am our national accounts manager and area manager for the East. Been with Metrex about 15 years now. So a lot of different roles, but yeah, happy to work for this industry. We're doing a lot of good. Try to protect patients and staff, so you know, honored to be a part of Metrex and the healthcare industry.
Look who's here!
I'm here. I made it. Sorry, guys.
Hey, no worries. We're only on introductions. We'll get to you. The man who doesn't need an introduction, but Jason, just finish up.
Yeah, so I'm based out of Atlanta. All is well. My 2 kids, wife. We're getting back to normal. School is back in session. We'll see how long that goes, so fingers crossed on that.
All right. Pat.
Hey, thanks, Ian. Pat Lurg, I am Jason's counterpart. I handle the Midwest and Western half of the country. I live in Michigan, just outside of the Detroit area, so not the same smoking hot weather that some of you guys have, but we've had a pretty good summer so far. So yeah, it's been a good year so far. I've had some family members affected by COVID-19.
Wow.
So it's been a pretty interesting experience with both my parents getting it early on in March and seeing kind of the negative impacts that they've continued to deal with. So that was a little bit scary at the time, but everybody's rebounded, you know, pretty good. We're lucky overall. So no complaints, but it does kind of give you the perspective of how serious things really are and kind of the importance of following all the procedures, wearing your mask, all those things. So
awesome. Well, I'm glad everyone is recovering or on their way to recovery.
Thank
Now,
you.
the man who needs no introduction, Chris Pellegrino.
Hey, everybody. Chris Pellegrino. I manage our distributor relations for Metrex. I live in Sarasota, Florida. Family's doing well. My wife actually went back to teaching 2 days ago, virtually. As of right now, kids are coming back to brick and mortar on August 31st, so we'll see how that goes. My 1-year-old daughter, everybody's healthy, which is great. Florida's getting a little bit of a bad rap based off of our friends, not to rip on anybody, but a lot of the cases are coming from the southeast part of the state. Where I am, we're relatively okay.
Yeah.
But you know, it is what it is, and we all just gotta be responsible. That's all.
You're right. Everyone's got to do their part. All right. Well, let's jump right into the questions. Again, you know, this is candid, casual conversation. What we want to know is we're going to get around to the resources you have available for points of care to reopen, but talk to us about the changes. I mean, your world, your product world, your manufacturing world exploded back in March. So talk to us about some of the changes you've implemented as a response to the pandemic.
Sure. It's funny. We have one of our product managers who's like Andy Dufresne in Shawshank Redemption. We're on 5 months and 3 days of allocation as of today. He's keeping a tally on his wall in his home office. But we had to do it because we just saw this huge spike in demand in the first 2 weeks in March from not only our medical customers, but our dental customers as well. Yeah. And, you know, really put a choke on the supply chain, both from our raw material standpoint and what our capacity was that we could produce. We've actually made some significant investments in our facilities to increase production. But again, we're beholden to our suppliers for some of those raw materials as well.
Right.
But one of the things that's nice about Metrex is we're not just a wipe company. We're not just a high-level disinfectant company. We've got several different product categories within infection prevention. So if a raw material is not available for this product over here, we pivot and produce this product over here. Some of our capacity increases have really been around liquids and sprays, so CAVicide, if you will, versus the wipes. So we're almost going back to the old world way of disinfecting a surface. You could spray it, you could wipe it, and it's disinfected versus just pulling out a wipe. Because look, wipes are going to be on allocation and probably in this hyper demand for the foreseeable future.
Right. No, you're right. And kudos to you for taking that nasty A word and dealing with it, because it's going to be around for a bit. And that makes me think, with the new regulations, the new, I sit on the commitment to cleanliness committee for Marriott hotels. And when you talk about new customers coming out of the woodwork that are going to have these products required, how do you deal with that along with the pressure put on your manufacturing? Who's got that?
That's a great question. I'll take that one because it dovetails right in. Look, I'm a Marriott guy, Ian, and I'd love for nothing more than to see Cavi wipes in every hotel room around the world. Yeah. We've been contacted by airlines, by hotels, by grocery stores. Heck, even FedEx called us to help outfit all their warehouses with product. But truly, our allocation model is basically around taking care of our existing end users, our existing distribution model, and getting the product where it needs to be at the frontline healthcare workers. Yeah. So we actually had to say no to a lot of those opportunities, which, gosh, a year ago I would have begged for them. But it's really been around. We've got to take care of our existing end users, make sure they're getting the products that they need because they've trusted us. They've trusted us to be standardized on our products. And it's our commitment to take care of them. So it's been very difficult to say no to new customers at this point, but it's a line we've had to take.
Well, and they'll be there. I am confident that our fight against germs and fight against viruses is going to be something that we do now for the foreseeable future. So, Chris, you talked about the new products that you have that are available in addition to the wipes. How are you guys getting that information out to the distributors? Who wants to comment on educating the distributors on the other Metrex products that are available to help?
Yeah, I'll take that one. So I think that's a really good point that you bring up, Ian, is there's an education piece of this that may have not existed in the past, right? Everybody knew that Metrex made disinfectants. They even sold a bunch of the products, but maybe didn't know what the different packaging options were. Yeah. How does one product compare to another product? If I can't get X, what does Y do? Is it a good replacement? So I think we've kind of run into something that maybe we would have liked to have educated in the past, but maybe folks didn't think was necessary. Well, now as a value add, the dealer rep really should know that information to provide that to their end user customers who are asking more questions than they've ever asked. So our Metrex sales team, the MedPro folks that we have on alternate care or our direct acute care sales force, they all work with NDC members, and their job these days is really getting them up to date on which products make sense for their end users. All the products are on list N, so it's not like we're worried about, hey, is this product on list N, not on list N through the EPA. It's a matter of those reps educating the folks on what they consist of, what they're compatible with, what the contact time is, how and where to use them.
And we've opened up, the inside sales team here at NDC has opened up. And, if you follow me on LinkedIn, you'll see a year ago I was doing videos with bouncers down on Broadway, and now we're pivoting to make sure that the information gets out to our member customers, our MedPlus customers, with just what you're saying, the education they need to know that there are Metrex products out there. That is a great point. So, distributors are out there, feet on the street, talking to the customers, reopening safely, successfully. What things do these distributors need to know to help their customers open safely and successfully? Who wants a crack at that?
Sure, I'll take that one too. We really think that they need to know how to reopen safely through using some of the assets that folks like Jessica and the rest of the marketing team and clinical team have worked to develop. So they've developed things like checklists, how, what, when, where, to disinfect, which products to use where. We think that those pieces of information are really important.
Yep.
But Chris also mentioned, hey, some products are on allocation, some products have raw material challenges. So the idea that they should really know who their Metrex rep is and have that relationship so they can kind of have an open line of communication to, hey folks, my customer uses XYZ. It looks like it's got a little bit longer lead time. In the interim, what could I help them get to? What could I help them use? Our guys are really well informed of that. We're not trying to do anything but be transparent with our team.
Yeah.
And they're able to kind of help direct. Maybe you haven't thought about this before, but you can bring a lot of value to your customer by considering using a liquid product instead of a white. And by the way, we have some documentation that'll help them make that transition if they're taking a 1 gallon bottle and filling up a 24-ounce bottle. So that way everybody is staying compliant. In the past, we've preached, please be compliant, follow contact times, all those things, but we're not so sure everybody really did that. Now it's hyper-focused on being compliant, and we have the tools to do it, but it's a matter of making sure that all the distributor reps know that those tools exist, so that way they don't have to be experts. They just have to know which tools to get to their customer and how to leverage their local Metrex rep for that education.
Jason, how do they find these tools and how do they find their reps? Is it through NDC? Do we have a reservoir? Do we have the resources online that we can make available to them?
Yeah, and it is on our website. And of course, the change just in the past year for us on the alternate care side is we've added the MedPro team. So it's more feet on the street, more communication, because I think all of us will admit during the pandemic time, communication is more important than ever.
That's awesome. Jessica, you're 5 months into Metrex and you couldn't have started at a better time.
I jumped right in, yeah.
Give me your thoughts on what you've seen and add to what we're talking about here as far as making sure the products are known, the resources are there, people are safe, and they're adhering to regulations. How do you synthesize all this?
Yeah, so to kind of Pat and Jason's point, we do have collateral that we've developed. So one of the things, like as Pat mentioned, we did kind of create this infection prevention preparedness campaign that was really geared towards offices as they ramp back up, kind of after that first initial, restrictions around COVID. They're starting to see more patients. So we've provided not only a checklist on how to ensure that they're properly disinfecting their offices to keep patients and staff safe, but also from a business ops perspective, how to kind of filter people in, what it looks like, these new normals. So we're kind of giving them some guidance as they open up their facilities. And then once they kind of go through our program, we're also giving them a certificate of completion that they can put on their wall just to kind of ease people's minds when they come into the office, like, hey, these guys are really proactive and I feel safe here. We also have some collateral around using those liquid surface disinfectants versus the wipes, because we know capacity constraints are a problem. So I've worked with your marketing team actually to get all of this stuff over to them so that they can disseminate it to your members and kind of give them the information that they need from our perspective on how we can help.
That's awesome. Great stuff. I will tell you, we said let's go 5 to 7 minutes on this, but the information you all have is so critical to what's going on. Thank you for your time. But before you go, I got to rate your rooms. You saw the other videos, I rate your rooms. First of all, they had their marketing managers cheat and they got the virtual backgrounds going. So that's an automatic corporate 10 out of 10. Jason, working from home, obviously working hard, didn't have time to go with a virtual background. Commend you highly. 9 out of 10. Me, I'm stuck here in Nashville in my office trying to make sense out of everything that's going on. I end up with a 0. Too much, no NDC behind me, but we'll find some for next time. Thank you guys. Appreciate it. Stay safe and keep doing what you're doing for America.
Thanks.
Thank you.
Thanks, Ian. Really appreciate it.